Hello, this is my presentation on child assessment guidelines. We'll be talking just about the essential um, kind of guidelines for conducting effective and ethical assessments. Intellectual and cognitive assessment is essential for understanding the psychological and educational needs of children and adolescents. It serves as a critical tool for shaping educational interventions and clarifying diagnoses and planning future development. Um, I know I normally don't give my 2 cents off script until later on in my presentation, but um, I do come from the world of special education where I see over assessment all the time. I see a lot of parents, teachers, caregivers trying to go out and get assessment to get a kiddo on an IEP or a 504 plan. Um, Sometimes because it makes parenting easier. Sometimes teachers seek it because they don't want to change the modalities that they teach in to reach kids where they need to be. Um, I find these cognitive and intellectual assessments to be very, very frustrating in how they are typically used. I'm sure I'll rant about that later on in the presentation. The purpose and importance of assessment. Inform educational placement. Intellectual and cognitive assessments are essential tools for determining most appropriate educational placement for children, ensuring they receive support tailored to their unique learning needs and potential. These assessments play a pivotal role in identifying learning disabilities, behavioral concerns, and other diagnoses that may impede a child's academic progress, facilitating timely intervention. The insights gained from cognitive assessment guide intervention planning and help professionals create targeted strategies to support children's learning and develop effectively. Through assessments, clinicians gain valuable information about the children that they work with, their needs, their processing abilities, the strengths and various cognitive domains, which is crucial for tailored support. Cognitive assessment helps children navigate not only academic challenges but also social interactions, equipping them with tools to thrive in both areas of life. Risks of misuse and overinterpretation. Reduction to a numerical score. When assessments are misapplied, they can oversimplify complex individuals into mere numbers, stripping away the unique characteristics and potential. When we score standardized tests, we can put we can pinpoint them on a bell curve or on a chart and say, see, the kiddo is here on this scoring sheet. And sometimes that can take away from what the kid is actually capable of, because then all of a sudden the kid might have a preconceived notion of what they're capable of, and maybe the teacher or clinician have some sort of idea of what they're going to be capable of. Either way, I think it can be overused and dangerous. Incomplete representation of ability. Standardized assessments often fail to capture the full spectrum of a child's abilities, leading to potential misdiagnosis or missed opportunities for support and growth. That's kind of what I just spoke on. Obscured contextual factors. Over-reliance on scores can mask crucial contextual factors such as social, emotional development and learning environment, which are essential for comprehensive understanding of the child's needs. If we don't look at the child as a whole, we can't truly understand if they scored the way they scored because they were in a home where maybe they didn't have breakfast or didn't have a good night's sleep, or if maybe there's chaos constantly happening in the home, or maybe something more sinister like abuse happening. Best practices in contemporary assessment. Comprehensive assessment approaches. Cognitive assessment should involve holistic approach, ensuring multiple dimensions of the child's abilities and challenges are considered. This includes using various methods and tools to gather a more complete understanding of the child's cognitive profile. Interests are a good one here. When we look at a kid who has zero interest in, I don't know, let's say science, but she's really into, I don't know, playing with Barbies or her dolls, and we're trying to have her read about frogs. Sometimes she might say, "Oh, well, I don't care to do this right now," and she'll score low on that part of the assessment. Or maybe reading comprehension, the passages that they're being asked to read have something that they have very little interest in, or maybe I've heard stories about these standardized tests that talk about snow, and there was an anomaly where students in the Southwest were scoring terribly on these reading comprehension assessments. Lo and behold, it was because of the fact that culturally in the Southwest, they never saw snow. They didn't understand what snow was. They didn't understand how the snow affected life and how it played into the readings that they were being asked to comprehend. Developmentally appropriate practices, essential assessments necessitate that clinicians be aware of sensitive developmental stages, ensuring that tools and practices are appropriate for the child's age and cognitive levels. That should go without saying. Even if a third grader has the intellectual abilities of a 16-year-old, the interests aren't the same. So if we're giving a standardized test for somebody who's in the third month of third grade, and we expect them, or excuse me, if we have a third grader who's taking an assessment for somebody who's in the seventh grade in the third month, the interests aren't going to be there. The assessment won't actually be standardized. It won't fit for the kiddo. Crucial considerations: cultural competence is essential in assessing practices. Clinicians must recognize and respect cultural differences that influence the child's behavior, learning style, and response to testing. Going back to the snow story in Southwest, I've also heard he talked about how the Inuit people have something like 25 different words for snow or different types of snow. Yeah, the number might even be higher than that. But culturally, snow is very, very important to their life and culture, whereas those kids in the Southwest didn't have to know 25 different words for snow. And so it didn't make sense to have the verbiage and language associated to a specific culture. Environmental impact on assessment. Environmental factors such as family dynamics, socioeconomic status, and educational support systems play a crucial role in the child's cognitive performance and should be integrated into the assessment interpretations. If somebody scores low on an assessment, maybe we find out more about their dietary habits. Maybe we find out more about what's going on at home. Is mom a single mom who has nieces and nephews staying at the house, and mom is working 13-hour days, so kid is expected to come home and try to do homework and make dinner or have dinner if he gets dinner and get to bed at a certain... there's a lot that plays into the environmental aspects. Clinicians are vital in administrating and interpreting assessments, ensuring that each child's unique context is understood and considered. Their expertise not only informs individual evaluations, but also shapes broader educational and therapeutic practices, ultimately impacting children's learning experiences and opportunities. Strong psychometric foundations. Standardized tests like the Welsh and Kaufman batteries provide reliable measures of intelligence due to their robust psychometric properties. However, these tools are limited by their capability to diversified learners. Standardized assessments often require students to conform with specific formats that may cater to their unique learning styles or strengths. This lack of flexibility can hinder some children's performance. The rigid nature of standardized tests may not reflect a child's true abilities, particularly for those with learning differences or special needs. These assessments often overlook contextual factors that contribute to the child's performance. I'll talk this one too. We often see if a kiddo regulates in a certain way and they're not able to regulate during an assessment because I don't know, maybe flapping or ukulele is not appropriate in the testing center, something like that. Maybe those are obscure examples, but I'm thinking for some of my kiddos who are on the autism spectrum, when they weren't able to regulate, their assessment scores went way down. And I think that was in part because of the fact that they could not use the regulation strategies under the confines of the structure of the standardized tests. Without proper context, and interpretation of test scores can lead to misleading conclusions about a child's abilities and potential. It is essential to consider the individual's unique strengths, challenges, and circumstances to ensure a fair and comprehensive understanding. Beyond the scores, composite scores can obscure an individual's unique abilities and challenges. It is essential to look beyond these scores to gain a comprehensive understanding of the child's cognitive profile. Identifying specific areas of strength and weakness across different subtests allows for targeted interventions and better educational planning. This approach supports a more nuanced understanding of the child's abilities. Qualitative data, such as observational reports and interviews, provide critical insights that enhance the interpretation of test results. Integrating both quantitative and qualitative information leads to a holistic view of the child, which is essential and must happen. And if you have to get rid of one, I wholeheartedly believe you have to get rid of the standardized assessment. But if you do that, there is a lot more knowledge base that is required out of the clinician or the teacher. The clinical interview is a vital component of cognitive assessment, providing a deeper understanding of the child's unique context. This process involves collecting information about the child's developmental history, academic experiences, and behavioral concerns, allowing clinicians to tailor interventions effectively. Behavioral observations is a critical component of cognitive assessment as it provides valuable insight that standardized tests may miss. It allows clinicians to assess a child's engagement and emotional responses during testing, contributing to a more nuanced understanding of their abilities and or challenges. Effective feedback is an essential component of the assessment process, ensuring that the results are communicated in a way that is respectful and empowering. By focusing on the child's strengths and providing actionable insight, clinicians can foster a collaborative partnership with families, promoting a better understanding of the child's needs and potential. I also think it's very important that nobody's left in the dark. The child needs to know what the assessment results are, and the parents need to know what the assessment results are. Now, with that being said, the parents and the child do not need the exact same information. We can interpret the results differently for the kiddo than we do for the parents, but we have to be 100% truthful and honest with both parties. Cognitive assessment serves as a vital tool not just for classification, but primarily for informing actionable strategies. Through proper assessment, clinicians are equipped to provide targeted interventions that address individual learning needs and foster developmental growth for children and their families. Effective intellectual and cognitive assessments are not merely about assigning scores or labels, but are vital tools for fostering individual growth and understanding. Clinicians must embrace a holistic approach that honors the unique abilities and contexts of each child. Each child is uniquely made. I don't care if two people have the exact same score on a data set. They are not the same person. We can't teach them the exact same. We can't speak to them the exact same. We have to cater everything to the child. Every child is unique. Through these assessments and the interpretations and the holistic approach, we can promote advocacy and support for their developmental journeys. Thank you. I do apologize for reading the last half fast. I spoke too much off the cuff on this presentation, but I do appreciate you sticking around and listening. Thank you so much. Have a great day.